Well, that was the news conference from the Chief Scientific Advisor, Sir Patrick Vallance, and the Chief Medical Officer, Professor Chris Whitty. They're speaking earlier on today, and you can see that again in full at 4:30 today. Let's discuss it in a bit more detail, though, and I'm joined by Dr. Duncan Robertson, an academic in policy strategy analytics at Loughborough University. Dr. Robertson, thank you very much indeed for being with us. We saw an awful lot of data being presented to us by the Chief Scientific Advisor and the Chief Medical Officer today, just to highlight where we are with this virus. And the most startling was that example scenario that they showed to us of where we might be in terms of case numbers by mid-October and how that might translate to deaths. What did you make of that? Tell us what it means.
Well, what the Chief Scientific Advisor and the Chief Medical Officer are setting out how this virus could go if we don't do anything. So if the government doesn't change the policy, what could happen? So they're not really saying what will happen, but what could happen. So if you look at those red bars there, you can see what will happen if it doubles in 7 days. 7 to 8 days is what the scientists have said is the doubling rate for this virus. So this is looking at what will happen if we don't intervene. And this isn't new. Sorry, this isn't new. This is not new science. The Chief Scientific Advisor set out on the 14th of July a report about what would happen. So it's worth looking at that if you want to see how the science was then.
I suppose it's a reminder at a time when cases are starting to increase of what we need to do, and they wanted to stress that message. It also showed us figures on the age brackets that are being most affected by this, because we were seeing in the early days of what looked like it was gearing up to a second wave, younger people being mostly affected. How is it looking now?
Well, I think what was really interesting with the chart that they showed about ages is in recent weeks, you can see it's all age groups that are actually increasing. So this is really showing that it is spreading throughout the population, not just young people, but also certainly throughout the working population, and particularly in the over 80s. So I've been following this for some months, and I produced a heat map, which you can see what's happening over time. It's another way of representing that graph there. So if you look at time, which goes across from left to right, you can see it started in the 20-somethings, and it's been spreading to the working population, and now it's in this over 80 population. And so in 1 week there, at the end of August, it tripled in the over 80 population. So that's really concerning, because the one thing with this virus is the outcomes scale with age. So if you're old, you will have much worse outcomes than you will as a young people. So the fact that it's in those over 80 category is very concerning.
Is that perhaps a reflection of what might be going on in care homes?
Well, certainly the Department of Health and Social Care has said that there have been cases in care homes, and Public Health England have reported the number of outbreaks in care homes. So, yes, care homes are obviously a very, you need to keep an eye on very closely about what's happening there. So we don't want to repeat what happened in March.
What about the geographic spread of this? Because we've got certain areas in the northeast, the northwest, who are seeing much tighter restrictions, but the sense was that the rest of the country might be following.
Well, I mean, you can only do a certain amount with data. And, you know, one of the things with data is it needs to be accurate and up to date. And, OK, from that map, you can see that there are outbreaks, particularly in the northwest and increasingly in London, where there is a higher prevalence. But one of the Prime Minister's strategy was all about, in order to release a national lockdown, you have to play whack-a-mole, I think he described it as. So this is where you detect local outbreaks and then you stamp down on them. Now, what we've been seeing with the overloading of the commercial NHS test and trace is we've seen that we're not able to know where these outbreaks are taking place. Yes, we can test at places where we know there are outbreaks, but we may be missing locations where there are new outbreaks growing. So at the moment, we can only see the number of cases as a minimum, because NHS test and trace doesn't have the capacity to test as many people as it needs to.
I guess then at the moment we look at hospital admissions and what's that telling us?
Well, as the data we have on cases becomes more and more unreliable, we have to look at other data. And the one reliable statistic we have is the number of people coming into hospitals. And we can see this is following a very similar trajectory that we did with the number of cases, just delayed a bit. So what tends to happen is we have cases going up. We then have admissions into hospital going up. We then have people on ventilators going up. And ultimately, sadly, we have people dying.
OK, Dr. Duncan Robertson, thank you very much indeed for taking us through those graphs and your analysis on that. Dr. Duncan Robertson from Loughborough University there. This is Sky News.